Black Friday for the Gambi family as 11 corpses were removed from the Douala Lakantini Hospital's mortuary today. The 11 victims, all members of the same family, died in a fatal road accident few days back in Idea, Senegal Maritime Division, Lithura region. They were on their way to bury their mother and other relatives when the accident occurred. A total of 16 people died in the said accident. That is our lone major story. Stay with us for details and more. Good evening, ladies and gentlemen. Thank you so much for joining me on today's edition of the 6 p.m. primetime newscast. For presentation, I am Immaculate Fogg. We'll begin with our major lead story. The corpses of 11 people who died in a fatal road accident in Idea, Senegal Maritime Division, have been removed from the Lakantini Hospital's mortuary today. The 11 victims from the same family were on their way to bury their mom and close relative when their bus collided with a heavy-duty truck in Idea. All the 16 occupants of the bus died on the spot. We have more with Anabila Leke.
Family members of victims of the fatal road accident which occurred recently in Idea present at the Lakantini Hospital mortuary for the corpse removal of 11 members of the same family who died brutally and suddenly.
Pleurer même nous a dépassé.
The family is still in shock as they lost either their brother, sister, niece, nephew, fiancé or wives.
Oui, j'ai perdu mon épouse qui s'appelait Ngombi Hélène. J'ai perdu ma fiancée.
One of the family members says the wife left a baby of 1 year and other kids at home before embarking on the unfortunate journey.
Elle m'a laissé 3 garçons. Ils ne peuvent pas voyager.
Traditional authorities from the Senegal Maritime Division, known as the Mbombok, were present at the mortuary in Douala for some traditional rites.
Depuis, on ne mourrait pas d'accident parce que nos parents avaient fait des rites.
All the 11 corpses will be buried this weekend in the Ndum village, not far away from Isika, in the central region.
To something else. Where are we with the Kamna Nickel Cobalt Manganese project in the East region of Cameroon? The interim Minister of Mines, Industry and Technological Development brought answers to the question as he visited the site. Professor Fu Callistus Gentry announces the relaunch of the project in November 2023 with new foreign partners. The population hoped that the new buyer would take into consideration the social aspect, and we have more done by Malaglory.
Minister Fu Callistus critically examines a sample of this nickel cobalt manganese of Kamna, a locality in the east region of Cameroon. The Kamna manganese project was launched 18 years ago by Jovier Company. The local population says they have been waiting for the realization of this project in vain. Many of those who were here when the project was launched are already dead. The interim Minister of Mines, Industry and Technological Development, Fu Callistus Gentry, carried out a walking visit on the site to relaunch the project of the exploitation of nickel, cobalt and manganese of Kamna. We are just from putting together all the necessary equipment for the effective start of the Kamna manganese project. We have a strong team and very reliable partners. The new contractor of the project promised the minister and the rest of the population that they will be reliable. You have natural resources in Cameroon which are sometimes exploited by neighbors and the rest of the world. A better system needs to be put in place in order to extract these minerals, treat and industrialize them. The minister added that works will effectively begin by November 2023 and will be beneficial to the population as compensation shall be given to those concerned. The locals expressed satisfaction and anxiously waiting for the project to improve on their living condition.
Malaglory reporting there. From big cities to hinterlands, the state of roads in Cameroon are in a deplorable state. Douala city dwellers have expressed worries following the annulment of the fifth stage of the International Cycling Tour. Our reporter, AC Lucy Liengu, visited these itineraries the cyclists had to use. She explained to us how the state of these roads looks like today. Take a listen.
Inhabitants of the city of Douala expressed dissatisfaction following the annulment of the fifth stage of the International Cycling Tour. They complained the dilapidated state of most stretches also contribute to slow down economic activities. Thus, the annulment of the cycling tour was evident.
Mais la course n'est pas bien passée parce que la route était bien accidentée. La route était accidentée, ils n'ont pas fait la course comme il fallait. Avant, ils font souvent la course ici, quand la route est bien arrangée, mais la route était un peu décalée, c'était pas bien arrangé. Donc...
Oui, je crois qu'on a même arrêté la course pendant cette catastrophe. L'état de route n'était pas bon.
Some locals of the PK12 market, Génie Militaire Lokbaba, Ndoko to say the roads were partially arranged.
C'est bon arrangé, c'est comme ça qu'on arrange le goudron. On a mal arrangé. Regardez vous-même, c'est comme ça qu'on l'arrange.
Moi-même, j'étais sûr que la course ne devait pas se passer. Parce qu'à voir l'état de la route, après j'ai suivi ce matin que non, la course a été neutralisée à cause de quoi l'état de la route.
The fifth stage of the International Cycling Tour was cancelled by Belgian cycling coordinator Laurent Génie, who noticed the bad state of roads cyclists were expected to use. This to the utmost discontentment of most Cameroonians.
And in a related story, the cancellation of the fifth stage of the International Cycling Tour of Cameroon in Douala on Thursday won't have any consequence on Cameroon. The declaration was made by the Southwest Regional President of Cycling, Barrister John Sishuwe Kameni. It should be noted that the cancellation is due to the bad state of roads in Cameroon. Smaji Gabriel reports.
Tongues are still waxing after the fifth stage of the International Cycling Tour of Cameroon was cancelled in Douala due to the poor state of the roads on the race course. Even though the race in its entirety hasn't been cancelled after what happened in Douala, the regional president of the Cameroon Cycling Federation for the Southwest says the technical officials didn't do their work well before the race came to Douala.
It could be a little bit unfortunate that maybe the technical team of the organizing committee might have overlooked certain things. But that notwithstanding, from all the information I have, which is very sure information, there was a heavy downpour which degraded the roads, and it made it almost impracticable for the cyclists to perform, and that is what is called a force majeure. And once there is a force majeure anywhere under any circumstance, it is very clear that the race could not take place. The technical part was not properly looked into, but once there's a force majeure, there's a force majeure, and I think that's it.
For Barrister John Kameni, the incident that happened in Douala was a natural one and won't dent the relationship between Cameroon Cycling Federation and that of the International Cycling Federation.
I'm not very sure because it's a force majeure. There could be a race in Tour de France and then immediately there's a tornado and it affects the race. But then it will not affect the relationship between the Cameroon Federation and the Union Internationale du Cyclisme. What is important is that the normal kilometers which were supposed to be run to make sure that the race has an international standard will not be run because of that. But they wouldn't come back again to Douala because there is a particular time frame or a chronogram which has to be respected. Generally, it's a force majeure. It would affect the number of kilometers being run at an international standard for that race. But then, it's sports. There's nothing you can do about it.
The 19th edition of the International Cycling Tour ends this weekend in Yaoundé.
And still in sports, the indomitable Lions of Cameroon are having their hands crossed ahead of their international friendly match against Mexico this weekend. This will be the Lions' third football encounter in Mexico in all competitions. Smaji Gabriel has a weekend sports package.
Cameroon's senior national football team takes on Mexico in an international friendly encounter this weekend at the San Diego Stadium in USA. Since the start of the week, the players of coach Rigobert Song-Banak have been fine-tuning their strategies on how to get a win against Mexico. Apart from Nuhu Tolo, Martin Ongla and Jean Onana, who will miss out because of diverse reasons, the indomitable Lions' opponent, Mexico, on their part, had a friendly match within the week they'll be meeting. Before Saturday's meeting, Mexico has an upper hand, beating Cameroon in their two previous meetings, 1-0 respectively, within the two. The hopes of Cameroon under-23 team participating at the Under-23 Africa Cup of Nations in Morocco has been dashed out as the Confederation of African Football, CAF's jury, rejects an earlier decision taken by the institution to eliminate Gabon. After the defeat of Cameroon by Gabon in Yaoundé, Fecafoot lodged a complaint about a player for Gabon who was overaged. Then CAF ruled in favor of Cameroon. Gabon further appealed the ruling, and the judgment dropped on Thursday evening that the Under-23 Lions were on their way to Morocco. As it stands, Gabon is once again qualified to play at the competition that will decide Africa's representatives at next Olympics. But Cameroon still has a chance of appealing this latest decision by CAF, this time around at the level of the Court of Arbitration for Sports in Lausanne. The Under-23 AFCON starts in less than 3 weeks' time.
Total CAF African Champions League winners.
We close our weekend sports package with this new development from the Confederation of African Football, CAF. According to a decision from the office of Dr. Patrice Mutsepe, beginning in the 2023-2024 football season, CAF has decided that all clubs participating at the African Champions League or the Confederation Cup must have a women's selection. It's upon this condition that the clubs will be given access to play in the two continental competitions. The deadline has been fixed for June 30, 2023.
That's it for the first part of the news. Talking Point is up next. Thank you so much for staying with us on Talking Point today. Access to health care is a fundamental human right. However, several villages in Cameroon are in dire need of healthcare services. Several villagers are obliged to cover several kilometers in order to be attended to by a healthcare professional. The few available hospitals in villages sometimes don't have the necessary equipment. Recently, kidney patients on dialysis took to the streets to denounce the poor services and treatment they got. High cost of healthcare is another major issue faced by the population. But the problem is, how can we solve healthcare problems in Cameroon? Answers in today's edition of Talking Point. And on today's edition, I will be receiving Professor Chodong Gachu. He is a consultant gastroenterologist and managing director of Premier Health Center. It is a pleasure having you on the program today, Professor Gachu. What is the current state of primary healthcare service delivery in Cameroon?
My understanding is that the primary healthcare service delivery in Cameroon is centered around the health districts. Now, the health districts in Cameroon were actually structured to be the first point of contact for primary healthcare for the citizens. And this was actually enshrined in the reorientation program that was carried out in the early 90s. In fact, the aim of that reorientation was to achieve the social goal of health for all, aiming to ensure universal access to primary healthcare services. Now, those services include district hospitals, the health clinics, medical centers, integrated healthcare services, and dispensaries.
Professor, tell us, what are some major healthcare challenges Cameroon is currently encountering?
Our biggest problem depends on who we are referring to. Now, if we look at the challenge from the perspective of the user, the biggest challenge we have is financing the healthcare. How do they finance their treatment? If we look at the services from the government's perspective, the challenge is how do we provide a health service that is fit for purpose? If we look at the service from the perspective of the doctor, is how do I get an appropriate environment where I can actually express the knowledge I have. Now, if we look at financing healthcare from the perspective of the general public, we know that money is tight for most people, but we know that healthcare is a very expensive commodity. So how can a poor person finance a very expensive commodity and still get satisfied from that? We also know that not everybody is ill at the same time. So if we try and get people to understand that pooling their resources together, they can raise enough money to finance the healthcare that will satisfy everybody when they need it, I think we will find that even in our poor resources, we can still finance a reasonable healthcare. What am I talking about? I'm talking about pooling of funds to finance the healthcare we need.
Professor, apart from lack of funds, what are some other major obstacles preventing efficient and effective healthcare in Cameroon?
Even though we are talking about healthcare, we need a well-functioning telecommunication system. We might also need a well-functioning power source, because that mobile communication might not be available because the power is not there. We talked about earlier on, we talked about the government equipping hospitals with modern technology. What is the point of putting a CT scanner in a hospital where you have power failure every minute? A CT scanner cannot run without power. So that CT scanner needs to be running without fail. Now, power failures actually damage the equipment far more than utilization. So the health system works on an ecosystem. So the whole infrastructure needs to be actually tightened up, needs to be upgraded, needs to work perfectly in synergy for us to have appropriate, adequate healthcare.
Professor, healthcare in some circumstances is very costly. In a country like Cameroon, where the minimum wage rate is just a little above 41,000 francs, how can Cameroonians meet up with such exorbitant bills given to them in hospitals?
Right, Immaculate. I think that is a dilemma for most Cameroon families. Most people, when they go to hospital, is usually catastrophic, because the costs of healthcare is high. Now, it is not because the hospitals want to make maximum profit or huge profit out of the population. It's just because healthcare is very expensive. Even in Europe, America, simple investigations, in fact, the cost of healthcare in Europe and America is far higher than the cost of healthcare in Cameroon. Now, how can the poor person actually afford it? Like I said earlier on, unfortunately, the situation at the moment makes it difficult. But if we try to anticipate what is going to happen in 10 years' time, and you think, now at the age of 25, I normally don't use hospital services or healthcare services significantly. But if I start contributing 1,000 francs a day, by the time I get to 40, I'll probably have contributed hundreds of thousands of francs. And that will be able to pay for my healthcare service needs when I begin to require the healthcare services. So what am I talking about? I'm talking about participating in some form of mutual funds, health insurance processes. Things like health insurance and mutual funds is not money you are giving to people because you want them to live a good life. is money you are putting into a pool such that if somebody amongst the contributors needs the service, there is money to pay for that service. Tomorrow it might be your turn.
And what do you think about the government subsidizing the cost of healthcare services, especially some major health complications like hepatitis, cancer, kidney failure, etc.?
Talking about subsidizing healthcare, I think that actually comes down to what I did discuss earlier on about information. I think the government subsidizing those services is something that the layman on the street does not actually understand. They think having a treatment for 3,000 francs is the actual price. Now, treatment for hepatitis or treatment or dialysis treatment is far more expensive than what the person actually pays, and that is because the government has already subsidized it. Now, I think this brings me to a discussion which I don't know if you were going to talk about that, but I want to anticipate it, which is actually a topic on universal health coverage. When we talk about universal health coverage, what we actually refer to is a coverage where people can actually access quality health care, when they need it, where they need it, without actually having to run into financial difficulties. Now, the big problem about universal health coverage is how do we fund universal health coverage for every country? Every country has to look at its own availability. In Cameroon, there is a lot of communication going around that the government is initiating universal health coverage. Personally, I think the government has already been funding universal health coverage in Cameroon for years. It's just it has never been labeled as such. When you go to a hospital and you pay a consultation fee in the hospital at 1,000 francs, that's practically a co-pay. The people who work in that hospital, the cost of running that hospital is far more than the 1,000 francs that people pay for consultation. Now, if that information is communicated appropriately, then the population will know that the government is already paying part of their health coverage. And that coverage is available to everybody. We talked about the health districts that is available. Every Cameroonian has a health district in which they live. They live within a health district. And that health district is funded by government funds. And that is part of universal health coverage. In universal health coverage, there are three main arms. Okay? There's the arm of what is covered, who is covered, and how much payment is covered. Now, we have a universal health coverage in the sense that there is a health district everywhere. Everybody is entitled to using that, so everybody is covered. How much you pay for it is what is the difference. And we should be focusing on how we improve that payment to reduce the cost to the user. And that is when, if that cost becomes affordable, we will see maximal use of the health services that we have.
Professor Ngaju, you just mentioned the universal health coverage. How much of a solution can this bring to the health problems of Cameroonians?
Now, following on from that, our biggest problem is how much of the cost of the health service that is being borne by the citizen. That is our big problem. Because as we know, we said earlier on regarding contributing towards mutual funds and the like, most people will prefer not to pay until it is really desperate. So if we can actually develop funding for the health system such that people don't pay at the point of use, I think that would be a fantastic solution to the country. At the moment, I think that is very, very far away from our arrangements. Now, some of the reasons why that is far away from our arrangements is education, cultural. Like we just said, people in Cameroon, they don't believe in contributing on mutualization. They will rather keep the money until it is desperate to spend it. But they have a different priorities, because I'm very certain that people will not hesitate to buy you a drink when they meet you in the pub, in the off-license. But that drink is worth more than what they can contribute for health services. Now, if you go to the United Kingdom, for example, people understand that they pay their insurances because it is necessary.
So now, how can the government improve the healthcare system of the country in terms of equipment and health facilities?
There is one issue about equipping health facilities. Okay. Now, medical equipment can be quite expensive. The cost of medical equipment also is also determined by the cost of maintenance. Now, if a government wants to equip the health facilities with up-to-date machines, I think the Cameroon budget might not be sufficient to supply all the hospitals we have. They can try by equipping specific hospitals with latest technology and making that technology accessible to other services. How can the government equip hospitals with latest technology? I think an important aspect would be to develop the human resources to carry out the maintenance. We know buying a scanner, for example, a CT scanner, is just one aspect of equipping the hospital. CT scanners can have 10, 15 years of life, but it needs servicing. If we buy a CT scanner and we need the service engineer to come from Europe, France, United Kingdom or Germany, every time we have a problem, it becomes an expensive equipment. So we also need training. So we need to train local people to actually do the local maintenance. And lots of those equipment will need such scenarios. So buying the equipment per se might not be as expensive, but maintaining the equipment to make it fit for purpose can become an issue.
Professor, let's look at a situation where standard health infrastructures are mainly in urban centers. What can be done for the people in hinterlands who have to cover several kilometers? Let's talk about those in the far north regions where they have to cover several kilometers just to have access to healthcare services.
Thank you for that question. Like somebody once told me, the healthcare system is an ecosystem. And like an ecosystem, there are various aspects of the system that makes it function properly. Somebody who lives in the hinterland, to access proper healthcare, has to travel to urban centers. The reason why healthcare are actually being placed in urban centers is because there is a big concentration of population within the urban centers. And so economically, it makes sense for that center to be located within the urban center. Now, the person from the hinterland coming to the urban center will meet a service that is fit for purpose. But it's difficult for that center to go to the villager. With technology, it's possible to actually carry some of the services from the center to the village. And what do I mean? Now, we know, and most people would have heard of telehealth. There are various things that can be done through telehealth that can actually reduce the journey for the villager. And that technology depends on various forms of communication. In today's world, where we have mobile communication, we can use mobile communication for telehealth. So most people will do video calls on WhatsApp, which is practically very limited cost. I don't see why you cannot do video consultation on WhatsApp. So that is one example of taking medical care to the villager. Now, you cannot do an operation on mobile communication, so the person will need to come to a center for that purpose. But not all healthcare need operations. Some form of healthcare can be done as an outpatient, and that can be done through telehealth. There is technology that is coming up, and various technologies are coming up that can be done remotely. I don't know if you are aware, but there are devices, you can connect a device to a smartphone that can actually record your heartbeat.
And now, this question, can a doctor or nurse who is poorly paid adequately take care of a patient?
When we talk about somebody being adequately paid, okay, we are talking about that person having enough money to live at a certain standard within their community. And that standard has to be acceptable. Now, that standard is based on the expectation of that person. So when you refer to somebody not being adequately paid, it's quite difficult to say what is adequate payment for the environment. Saying that, if the person perceives that their pay is not adequate, I'll be very honest with you, that person will not be happy going to work. That is not unique to Cameroon. It's not because they pay somebody 50,000 francs that the person is not adequately paid. I know, I have practiced in the United Kingdom for so many years. I know doctors who will earn, comparatively to Cameroon, if I convert that into CFA, there are doctors who will earn 5 million francs a month, and they still feel they are not adequately paid. And that is because in the United Kingdom, with 5 million francs a month, you barely manage to have a decent house. Let alone thinking about sending your children to top schools or having the latest fashion. So adequate payment actually depends on your environment.
Professor Theodore Gachu, consultant gastroenterologist and managing director of Premier Health Center. And that's what will put a cap to today's edition of the 6 p.m. primetime newscast on Equinoxe Television. Thank you so much for your keen attention. Stay in company of more interesting programs on ATV. So long.